speaker on the books today. Dr. Morwood comes today with many worldwide experiences and dealt with, and his level of talent go above and beyond words. Some of the pictures I've seen and the kids that have benefited from his hands are so inspiring and hard to describe at times. So with that said, Dr.
Matt, thank you very much for the very gracious invitation, and Dan, thank you for helping me to arrange to give a report. What I'm going to discuss today is Rotary International programs, Rotoplast and Alliance for Smiles. These two programs provide free plastic surgery and treatment to underprivileged children worldwide with cleft lip and palate. This program started over 20 years ago. I was honored to be one of the surgeons on the very first trip. We went to Chile, and now it's spread to other countries in about 5 continents. Here's a little girl. She's about 9 years old. We met her in China, and there she is the day after, 2 days after her repair. As you probably know, cleft lips and cleft palates come in all sorts of varieties. That's a cleft lip and a nose revision. Here's an incomplete cleft lip. We distinguish a complete cleft lip or an incomplete cleft lip, meaning if it goes all the way up into the nose, that's a complete cleft. It's a little more challenging than an incomplete cleft, which is not ascend all the way into the nose. And of course, these come in all sorts of varieties, as I said. The clinic is where we meet people, and I'll be going through a little more about the detail of how these programs are administered. All sponsored by Rotary and Rotary International. Alliance for Smiles and Rotoplast are 2 of the programs. So as I said, we started this program in South America, going to the country of Chile. Now we've spread to, I guess, 5 continents. We go to Asia and Africa and Eastern Europe and all over Central America and South America. The way this program works is that these are essentially headquartered in San Francisco. And I'm going to come back to that idea of sponsoring a trip from the Monterey Bay towards the end of my presentation today. So what we do is we fly into a capital city like Caracas, or we might fly into Shanghai or Hanoi, someplace like that. And then the local Rotary Club are responsible for arranging transportation to get us to a town where we're going to operate. And they spread the word ahead of time that the American team, the Rotary International team, will be in a certain town on a certain day, and so the families arrive with their children ready to be checked out. And it's really quite incredible how this program has spread. As I said, we started in South America, now we go to about 5 continents. I've been to Vietnam, I've been to China. This past January, a couple months ago, I was in Africa for the first time, all over South America and Central America, of course. It's surprising the number of children born worldwide with cleft lip and palate in countries that do not have the resources, education, or healthcare system to repair these deformities. Because we can accomplish that. A cleft lip repair takes about an hour and a half. A cleft palate repair takes about 2 hours. And it's a remarkable contribution to restoring these children to health. And we also do some teaching, and we're very proud of that because we want these countries, and we want the Rotary clubs within these countries to take over the program, Rotoplast or Alliance for Smiles themselves. During clinic, the children line up with their families. They're seen by nurses. They're seen by us. Sometimes I go once or twice a year to various countries. Sometimes I'm chief surgeon, sometimes I'm staff surgeon. But the children have to be evaluated and go through what we call triage. It's like going to the emergency room. You have to be assessed about what's going on. Is the child healthy enough for an operation? Could they be handled there by a plastic surgeon? Do they have to be one day hopefully sent to the United States or Europe, etc. for their care? So here again, these children are in triage. There's an incomplete cleft lip. There's the cleft lip repair on the table. Here's another complete cleft. And as I said, these cleft lips and palates occur all over the world. And I'll give you some data and statistics towards the end of the talk. What plastic surgeons used to do is simply kind of pare the edges. In other words, cut the edges of the lip and sew together. We've progressed now to the point where we try to get a very natural looking lip and nose, as well as a functioning palate. What I want to point out is the Cupid's bow is, of course, the normal contour of the upper lip. There's a slope up, a slope down, a slope back, and then progressing laterally. And this is what we call the philtral columns. There's one on the right and one on the left. And so sometimes when I show cleft lip repairs, people think that I missed the midline. Well, we're not trying to hit the midline, actually. We're trying to line up the scar on one of the philtral columns. And of course, sometimes there's a bilateral cleft. Instead of just paring the edges or trimming to fresh tissue, it's now done with a series of flaps. We move the tissue around, go up into the nose, do whatever we can during that first operation. I don't mind telling you that a cleft lip repair is considered to be one of the biggest challenges we see in plastic surgery. It's really one of the pinnacle operations. And I'm very grateful that you've allowed me to go on these trips, because I think there are very few plastic surgeons in private practice that have done hundreds of cleft lip repairs and palates, as I've been able to. I recently went to Africa this January. For some reason, it's been a professional goal of mine all my career to operate on children in Africa, and Rotary International was the vehicle for me to being able to do that. We went to West Africa. We were greeted by drummers and dancers. Of course, we held our clinic, and the clinic is when people come from all over that area, and the word is spread by the local Rotary clubs. The children are triaged. Again, we categorize or triage the patients according to incomplete cleft lip or cleft lip, cleft palate, etc. Very friendly people there. I met a couple other drummers while in Africa. Very hospitable, very happy to have us there visiting. They're working very hard on their own healthcare system. And again, part of the goal of Alliance for Smiles and Rotoplast is that the host country will assume care of these children themselves and one day take over the program. And I believe that the first country we went to, Chile now is considered almost not to be a third world country anymore, and they are taking over their Rotoplast program so that children get taken care of by their own surgeons, doctors and nurses, etc. But in Africa, they were very hospitable, very happy to have us there working with them. These are tribal marks in West Africa on this woman's face. I want to go through some of these cases. Here's a very wide left unilateral complete cleft lip. Again, I just did this in January, and there she is on the table. Again, the philtral column, we try to put the scar either on the left or the right. In other words, we're not aiming to put it midline. That would be a mistake if it was midline. Here's what we call a bilateral cleft lip, again in West Africa in January, where it's on both sides of the philtral column. It's a pretty challenging case. Here's a gal with a complete cleft on the left side. Again, in West Africa, there she is on the table. Hard to believe, in some of these countries, the surgery is just not available to them. And if they don't have the resources to get out of the country, then they grow up with an unrepaired cleft lip or palate. To us in the United States, it's almost inconceivable that someone could get to be 50 years old and never have the operation that they need. And this operation takes about 90 minutes. And the vehicle to deliver this health care is Rotary International. And part of the reason I'm talking today is not just to tell you that I'd like to have I think it's time for us to have a Monterey Bay-based trip, but to thank you. And I hope that you all feel the pride that these teams feel, that I feel, that you belong to a club that provides this type of care. Again, I just want to back up. Here's this gentleman, he's about 50 years old. After a 90-minute operation with Rotoplast, or this was actually Alliance for Smiles, he can interact with society, and some of these people are able to leave their house for the first time. So what happens on we bring a team of about, this was a relatively small team. I was the chief surgeon, I had an assistant, a staff surgeon from India, great guy, we had about 10 nurses. Now, sometimes people ask me, why does this deformity happen overseas, but it doesn't happen in the United States? Well, actually, it does happen in the United States. This is a child I did right here in California. That was at birth. We wait till the child is at about 10 weeks old. There he is after we took out the stitches. So I do these here in Monterey and in California, of course. However, the reason why we're not so aware of cleft lip and palate in this country is because the babies and the children get repaired. So you don't go down on Alvarado Street and see people with unrepaired cleft lips and palates that you might see in other countries. A lot of these children, they won't go out. Of course, I'll show you some cases where they've never left the farm, or they've never been to school. And please keep in mind that this deformity does not affect their mentation. In other words, these kids are very capable. They're of normal intelligence, but the cleft lip makes them look almost like social outcasts. And I'm going to talk about the difference between a cleft lip and a cleft palate later. The palate is the roof of the mouth. That's where the split is. And that profoundly interferes with their speech. So I'm going to talk about that again. So cleft incidence. The highest incidence of clefts in the world is outside of Shanghai, China. 1 out of every 250 births. In the western side of South America, that's Chile and Argentina, it's 1 out of every 400 births. In Europe and North America, and in the Caucasian population, it's 1 out of 1,200. In Africa, it has actually the lowest incidence, 1 out of 2,000 births. However, because of the relative scarcity of plastic surgeons who are trained to do cleft lips and palates throughout the world, we see a lot of these go unrepaired. Even in Africa, where you might think, well, it has the lowest incidence, but they don't get their repairs. Wherever we go, we certainly work with the host surgeons and nurses, making friends. That's one of the Rotary principles, I think, right? Make friends wherever you go, so I try to do that. Here's a very wide cleft lip. This was from Vietnam. There's about 2 days after the repair. Here's a pretty wide cleft, complete cleft in China. And there's the mother posing with her daughter and her surgeon. This case I'm showing because in this country, if a child is born with a complete cleft of the lip and palate, chances are between 10 weeks of age and 16 years of age, they will be seen by the team that is composed of a dentist, orthodontist, ENT surgeon, maxillofacial surgeon, and not just the plastic surgeon. So of course, we'd be delighted to be able to repair her teeth and have her see an orthodontist at first. However, we do what we can in the 90 minutes and in the 2 weeks that we're there. Here's a case I'm particularly proud of. Here's a little boy from Argentina. I've been to Argentina 4 times. I've been to Chile, I guess, 3 or 4 times. It's a great opportunity for me to go back to a clinic, and when these children come back and I can see the results of the work, or sometimes we do the palate, etc. And there he is about two years later. Now, I said that I would talk about the difference between cleft lip and cleft palate. I want everybody in this room is smart enough to understand the difference between a cleft lip and palate. I've been showing you cases of cleft lip. Cleft palate is the roof. The palate is the roof of the mouth. And there's a little. Let me back up. There's a little girl. She's pretty. She's with a Rotarian volunteer, Kelly. She's pretty. You might wonder, why is she coming to a plastic surgery clinic? If you look at the roof of the mouth, the palate has a split. That's a cleft palate. The cleft lip is what you can see on the outside. The cleft palate is a split in the roof of the mouth, of course. And the problem is they have difficulty suckling. It's hard for them to make a vacuum. They can't clear their ears. They get frequent ear infections. But the difficult problem is that they have a very hard time articulating certain words. In English, they have a hard time. In some of these languages, where they're very kind of guttural, where you have to do a lot of clicking and make those sounds we call fricatives and explosives, they really have a hard time communicating. So you can see, you can imagine when a child has a cleft palate, they have a hard time suckling because they can't make that vacuum. There's a boy who has a cleft lip connected to the cleft palate, and so we repair those with a series of little flaps on the roof of the mouth, etc. So in China, they've been very hospitable, and Alliance for Smiles is actually establishing treatment centers in China. There's a little bit of different philosophy. They're both sponsored by Rotary International. Rotoplast essentially is making individual trips to places. What Alliance for Smiles is trying to do is concentrate in certain places like China to establish treatment centers. Here's a Chinese baby, unilateral cleft lip on the right, very grateful mother. There's a bilateral cleft. Very difficult operation, but very rewarding. The parents are very grateful. Now here's another little girl in China. She looks normal, but if you look at the roof of her mouth, there's a palate. And of course, wherever we go, that the local Rotary Club is responsible for arranging for the hospital, helping us with transportation, meals in a hotel, etc. There's a scene in Vietnam. I got to operate in South Vietnam once. We do cleft lips and palates. We also do some congenital hand problems. Here's a little girl who looks normal, but she fell into a fire when she was about 3 years old and burned her chest. She couldn't lift her hand up higher than her chin, and you see she has a very severe scar contracture in the armpit, a series of Z-plasties, sometimes we do skin grafts. So about 2 hours later, she could lift her hand up and comb her hair, etc. How are we doing for time? Are we okay?
We had about 10 minutes before questions.
10 minutes, thank you, appreciate it. So, I don't mind talking about money. A lot of people want to know about the money. I don't get paid to do this. None of the medical volunteers are paid. These trips cost, depending on where you go, in the range of $100,000. We have to buy the plane tickets, the airfare, the supplies. The host Rotary clubs also have to be responsible for helping us to find a place to stay, etc. And as I said before, I'm very grateful for the support from Rotary and support from Rotary International, and I do want to say thanks to the Monterey County Hospitality Association. I think Steve McNally was here. My gig money, many of you know I'm a drummer, my gig money helps to fund these and helps to support me and helps me to pay the expenses okay, so thanks to the Hyatt Regency and Mission Ranch and Chivos, etc. I thought a lot about this next issue, but so many people ask me about it that I do have to mention it. When we were in West Africa, there was some radical attacks on places where Westerners were staying. Maybe you know, there was recently a bomb of a Rotary polio vaccination center, and Jakarta was bombed, and a university in Pakistan was bombed. While I was in West Africa, while I was there in West Africa in January, at another place in West Africa, there was an attack on a hotel where Westerners were staying, and they specifically targeted the surgeon, and he was kidnapped. So it gave us a chill, of course, because we were concerned about coordinated attacks. There's some very smart people in the State Department who communicate with Rotary International, and the reason I'm talking about this is because it has changed the way the program is kind of marketed or promoted within a country. It used to be that for a few months before we got there, word was broadcast around the entire country that American team, doctors and nurses, would be in a certain town on a certain day, so line up, and the kids would line up by the hundreds. Well, you can understand that isn't very highly advised anymore. So what they do is more low-level marketing. They let the promotion, I don't know why I want to call it marketing, but they spread the word through pediatricians' offices and doctors' offices and more of a low-level kind of a promotion through Rotary clubs. When we actually arrive, it gets a lot of media exposure, so other children come in. But it certainly used to be 200 kids would be there on our opening clinic. Now it's more like 75, but we almost always fill up the schedule because when we are there, the media helps us to promote and spread the word. It was also kind of interesting. I operated last year in Bangladesh, And this is not a political talk, but many of you remember the division, or in 1949, how India kind of broke up some areas, and the Hindus were supposed to go one place, the Muslims were supposed to go another place. Has not really worked to stop fighting, but it's better. In Bangladesh, we saw a lot of burns, and of course, we are not, we don't care the color or ethnicity or where the children or the family worships. That's just not an issue to us for Rotary International or Rotary, Rotoplas or Alliance for Smiles. We see all these children, regardless of their ethnicity, religion, etc., and they're all uniformly grateful to have us there. There's a little girl who fell into a fire when she was about 2 years old. A lot of them have cooking in open pits, etc. And so I worked on her for a couple hours on one hand to free up some of her fingers. Very grateful people. So, do I have 5 minutes left?
Yeah, you got 10 minutes left in total.
Oh, 5 minutes and then 5 minutes of questions. So, I've been doing this for 20 years, and of course I'm very grateful for the support. I think it's time that we have a mission based on the Monterey Bay. We've got 5 hospitals between Santa Cruz and Salinas and Watsonville and Monterey. We have our surgery centers. I think that we can get 10 medical volunteers. I think that we can get 10 non-medical volunteers to have a mission sponsored by the Monterey Bay. And I am so delighted that Frank and Kathleen Geisler are here. That's Kathleen still looking so awesome. I don't know, Kathleen, this is when we went to Chile or Argentina, I don't remember exactly, some years ago. That's Sue, wife of the late great Ted Hooker. Cindy was married to John Hutchinson. These programs really operate, no pun intended, they function on volunteers. And it's really Rotary International and the Rotary volunteers and Rotary clubs that make these projects go. I don't want you to think it's one surgeon getting on a plane, flying to another country, and operating. This takes months of preparations. The word has to be spread. The clinic has to be organized. The teams have to be fed. The children have to be transported. It's months of preparation to get this done. And I think we can do it. In the charter of both Alliance and Rotoplas, it's stated that we give babies and children free care. But you can understand, I bet, when an adult walks in with an unrepaired cleft lip or palate, you just want to get to work. So there's that guy. About a week later, I think I met him in Colombia. He had never really been off the farm, never been to school. His family assigned him the duties to just take care of the farm because he was kind of an outcast. Here's a case. I just want to show you a few more cases because I want you all to feel the pride that we feel going on these trips. This project is a Rotary project. You ought to feel the pride and know that you belong to a club that supports this kind of health care for children in underprivileged countries. Here's a little girl from, I think, Bolivia. If you look at her, you can obviously see the deformity. If you look at her mother, see her look of concern. And then I got to go back about 2 years later to do her palate. And so it's very rewarding for us, and I hope you all feel the pride of that. They're very grateful people universally where we go. All over the world, this deformity occurs. It's not just in underdeveloped countries. It was a touching story for me to meet this father, obviously with an unrepaired lip, brought in his son and said, I would love for you to take care of my son and do an operation so he doesn't have to grow up the way I did and get bullied and be an outcast. And we said, well, what about you? He goes, I know this clinic is for the children. Well, you can understand how we wouldn't let either of them go until we patched them up. So we were very happy to do that. Here's a gal from Bolivia who was very intelligent. She never had left the farm, never left her small town. She had an amazing business of making blankets and weaving. She organized a bunch of the women in her town. The story that they told us, her uncle rode up to where she was on a horseback and said he heard an American team was coming to a town and would operate on her for free. She didn't believe it. and she thought she thought her uncle was making fun of her. Well, she looked into it, and sure enough, she came to our clinic and we patched her up. First time ever that she had been able to interact on a more social level with people out in town. Here's a little boy. I think this little boy was from Argentina. We got to go back a year later and see him. And again, all over the world. Here he is about 3 years later. Here's one of the tough cases I did in Chile. Very difficult, very wide case. And I'm happy to report the past 20 years, Rotary, Rotoplast, and Alliance for Smiles has operated on over 24,000 children worldwide. And really a very program. Not only am I happy to have your attention, I'm very grateful for your attention today, but I thank you for allowing me to be your international emissary. Thank you very much.